it got worse, and then it got worse. And then you said, oh my God, how much worse can it get? And then here's your answer.
A nurse says many hospitals simply don't have enough employees to care for the number of patients who are coming in. Hospitals are dealing with critical staffing shortages at a time when beds are filling up. As Fox 43's Rachel Yankunis reveals, the issue has been building long before the COVID pandemic.
Nurses are quitting because of burnout. That burnout is caused in part by staffing shortages. But this issue predates the pandemic. Fox 43 reveals what's driving the nursing shortage and why this is not a surprise to the industry. Frontline nurses are leaving the bedside in record numbers.
I know a lot of healthcare workers that are quitting because they are overworked and underpaid.
But COVID didn't cause the problem.
I'm tripled again in the ICU for 8 months now, almost every shift.
It exposed it.
There's just too many sick people and too little bit of employees.
Have you ever thought about leaving the profession?
Every single solitary day for the past 2 years.
Jennifer Partika has been a nurse for 27 years. She says ongoing staffing shortages make it hard to maintain safe patient-to-nurse ratios, pushing healthcare workers to a breaking point.
With limited resources, what are you going to do? You can't turn patients away. Like, you have to take care of patients who's going to take care of them.
One medical study found if you're in the hospital, your chances of dying go up 7% for every additional patient your nurse cares for. Pennsylvania has a bill pending that would limit the number of patients for each nurse. But hospitals say that isn't practical, especially given the shortage.
We're just not in favor of a one-size-fits-all mandate for nurse staffing ratios. It's also important to understand as well that every situation, every hospital is different, and care is delivered not just by nurses, but by a care team.
We should have been doing something a long time ago.
Betsy Snook, CEO of the Pennsylvania State Nurses Association, says staffing issues are nothing new.
How long have there been staffing issues at hospitals? Does it predate the pandemic?
Oh, yes, it's been decades, Rachel. Decades.
Chronic understaffing is one reason why nurses are now quitting in droves, and it's happening at a time when baby boomers are retiring, leading to severe shortages in hospitals and nursing programs.
We've had to turn away as much as 80,000 qualified nursing students because we haven't had the faculty to be able to teach them.
And hospitals can't replace staff fast enough. Fox 43 reveals that turnover rates for nurses have spiked since 2019. A survey by the Hospital and Health System Association of PA found, on average, 27% of nursing positions are not filled, and 45% of nursing support staff jobs are open.
Well, hospitals are taking extraordinary steps to meet the needs of patients. As part of the survey, some of the strategies include sign-on bonuses for new employees, retention bonuses. In many cases, they're offering tuition reimbursement or continuing education. So that's really the focus of the hospital community.
The nursing community says it's time they have a seat at the table. They want the state to establish a chief nursing officer within the Department of Health to give them a voice during this public health crisis.
I really feel that nursing leadership is the thing that we have missed during the past 2 years.
If these trends hold, a study on the U.S. healthcare labor market projects Pennsylvania will be short nearly 300,000 healthcare workers by 2026, including more than 20,000 nurses. We have a link to that data on our website, FOX43.com. Fox 43 reveals issues that affect you and your family to keep you informed. If you have a topic you want us to investigate, send me an email at FOX43Reveals@FOX43.com.